Testing 1, 2. Testing 1, 2 French.
Morning, Counselor.
Good morning, Joey. How are you?
I'm good, thank you. Did you enjoy your long weekend?
I did indeed. Had some family to visit. My wife's parents, so it was very nice to see them. How about you?
Well, we didn't do too much. I had I'm doing coursework. So I had an assignment due on Tuesday. So that's really what I was focused on, and just watching the Instagram videos for my sister's kids running around for Easter.
Right on.
Yeah.
And what are you studying?
It's still the municipal, is through AMCTO. So there's a program called MAP. So right now there's 4 units. I'm on the 3rd unit, which is municipal finance. So just going through that.
Sounds riveting.
Yeah, let's say riveting. Well,
Okay.
That's a good word for it.
As in you're riveted to your chair.
Yes.
So you don't get up. Yeah, no, that's fair.
So we do have Councillor El Shantiri that won't be here today.
I did see that.
We have one inquiry from Councillor Tierney, and Donna said if we do have to go past a certain time, she will have to step out, but Sarah will be along.
I don't think we will.
Okay.
I'm hoping anyway.
Morning, Donna.
Good morning, Donna.
Good morning.
We'll give it a shot, Donna. Items 2 to 4 are pretty pro forma in that they're delegating authority to deal with provincial funding. So I'm hoping we'll be able to pass them on consent, but you never know.
And Counselor, just to let you and other members know, we are live.
Thank you.
Good morning. Testing audio and video.
Looking good, sounding better. Good morning, Teresa.
Morning, Matt.
How are you?
Not bad, not bad. It's
Is
going
the
to be a
ice-
rainy day, so I'm glad we're inside for.
Me too. Is the ice all out of the bay yet? Are you ready to hop in?
Oh, they're out. The guys that were surfing on the ice are now surfing the waves.
Oh,
The
awesome.
big kites. Yeah, it's really fun to watch them.
You're not ready to hop in yet, though, yet?
I would love to try it, but I think I would try it on ice first,
Fair.
not in that frigid water. Though I will swim in it in about a month or so, but not yet. Hi, Keith.
Morning, everyone.
Morning. Are you counting the days?
Not exactly, not exactly. So people have been so kind in their comments, and I've been getting emails, endlessly since I made the announcement, and people have been so kind. It's been lovely.
Congratulations on 12 great years, Keith.
That's fantastic.
So it's up to the three of you and the others not to screw it up going forward. So
We'll do our best. Good morning, Laura.
Strategy is to say it's Matt's fault. Yeah, that.
Good morning, Catherine.
Good morning.
Morning, Tim. Good morning, Ralston. Good morning, Caroline. Said you met. We have quorum. Oh, good morning, Catherine. Good morning, Diane.
Good morning.
Good morning, Riley. It's nice to see everyone. So welcome to the Community and Protected Services Committee meeting of April 21st, 2022. I'll call this meeting to order, and we are being held remotely today through Zoom on this dreary April morning. Please note that the meeting is also being live streamed on the Ottawa City Council YouTube channel. I'll provide each committee member with the opportunity to ask questions or comment on each item. Committee members will be called on first, followed by any other members of council who have joined the meeting. As I've mentioned before in the past, I'm not really wonderful at that. So if your hand goes up first, I'll probably just call on you first. I hope that's okay with everyone. Members are also reminded to submit any motions, visual supports, or declarations of interest in writing to the coordinator at their earliest convenience. And when it's their turn to speak, delegations will be admitted as panelists to the meeting, allowing them to turn on their microphones and cameras. Today, we have no delegations, so I'll skip forward. The committee coordinator and I will be watching for the cues when you wish to speak. And the usual 5-minute speaking limit for delegations will apply, but of course you can hop back on the board again, no problem. Although the deadlines have passed for residents to register to speak at this committee, you still may make written submissions prior to the council meeting scheduled for April 27th. If you have technical difficulties signing into the meeting, you can contact the clerk's office at committees@ottawa.ca or by calling 613-580-2424, and the extension is 16875. I'd like to begin today's meeting by acknowledging that Ottawa is built on the unceded Anishinaabe Algonquin territory. The people of the Anishinaabe Algonquin nations have lived on this territory for millennia. Their culture and presence has nurtured and continues to nurture this land. The City of Ottawa honors the people and the land of the Anishinaabe Algonquin Nation, and the City of Ottawa honors all First Nations, Inuit and Métis people, and their valuable past and present contributions to this land. Today, we have one regret. Unfortunately, Councillor El Shantiri cannot join us today. And can the committee coordinator please call the roll?
Yes, Councillor Deans.
Here.
Councillor Dudas.
I'm here.
Councillor Fleury.
Good morning.
Councillor Kavanaugh.
Here.
Councillor Kitts.
Here.
Councillor McKenney.
Present.
Councillor Meehan.
I'm here.
Councillor Tierney.
Here.
Vice Chair Eglite.
He is with us.
and Chair Luloff.
I have not left. Thank you very much, Joy.
You're welcome.
Today, we have a number of reports from the Community and Social Services on the agenda, including an important update on the progress of the Community Safety and Wellbeing Plan, which this committee approved in the fall of 2021. Nous avons à l'ordre du jour une importante mise à jour sur l'avancement du plan de sécurité et de bien-être dans les collectivités. As you'll recall, this plan sets out strategies to address the most pressing risk factors to improve community safety and well-being for everyone in Ottawa. Le plan est fondé sur l'action collective et le leadership communautaire. La ville réunissant des partenaires et des ressources pour favoriser le changement en fonction des priorités approuvées par le Conseil. Depuis l'année passée, le personnel travaille d'arrache-pied pour mettre en place la structure de gouvernance qui permettra à faire avancer ce plan. They've been in dialogue with community partners and stakeholders to ensure that we bring the right people and groups to the table and that the voice of the community is heard. We'll hear more about that structure from Donna Gray, our incredible General Manager of Community and Social Services, and Sarah Taylor, our Director of Community Safety, Wellbeing, Policy, and Analytics. They're joined by a special guest presenter today, Dr. Claire Kendall, the Associate Dean for Social Accountability in the Faculty of Medicine at the University of Ottawa, to tell us about an exciting new partnership that brings the expertise and creativity of the university faculty and students to the community safety and well-being conversation. Nous avons également devant nous aujourd'hui 3 plans de dépenses des services du logement. Elle expose les plans relativement à l'affectation des fonds annuels que la Ville reçoit d'autres ordres du gouvernement en vue de souligner d'importants programmes de logement. So as I just said in French, we have 3 spending plans from Housing Services before us today. They set out the plans for allocating the annual funds the city receives from other levels of government on important housing programs. These include homelessness prevention, supportive housing, housing subsidies, and repairs and retrofits to social housing. Saeed Saya, our Director of Housing Services, will give us a brief presentation on all 3 of these reports, should we wish to hold these items for discussion. Alors, passons maintenant à l'ordre du jour d'aujourd'hui. We've received no declarations of interest. Are the minutes for the meeting of March 31st, 2022 confirmed?
Confirmed.
Thanks, everyone. It is really nice to see everyone today. I know some of us have been battling some health issues. Everyone looks so great today. It's nice to see everybody out and looking great. We have received no communications or correspondence. So we'll go through a consent agenda. Any items that you wish to hold, just put your hand up or say hold, and that's no problem at all. The first item, however, is held for a presentation. It is the Community Safety and Wellbeing Plan Progress Update. So we'll be receiving this report for information, so we'll hang on to that one. Items 2, 3, and 4, as I mentioned in the opening remarks, are about how we're allocating provincial funding. So item number 2 is the Canada-Ontario Community Housing Benefits. Does anyone wish to hold this item? Councillor Fleury wishes to hold this item. Okay, we'll hang on to that for you, Matt.
Chair, I have a few questions for all those 3 reports.
Okay, we'll hold all 3 then. That's no problem. We'll give Saeed an opportunity to make a brief presentation on all 3, and then we'll open things up to questions. That's no problem. So skipping ahead then. Item number 5 is from the Office of the City Clerk. Status update, CPSC inquiries and motions for the period ending April 7th, 2022. And that the recommendation is that the Community and Protective Services Committee receive this report for information. Is this item received? Received. Thanks, everyone. Okay, so we'll begin with item number 1, Community Safety and Wellbeing Plan Progress Update. I'll now turn the floor over to Donna Gray and Sarah Taylor and Dr. Claire Kendall. Thank you so much for joining us today, Dr. Kendall. Please go ahead, Donna.
Good morning, Chair and members of committee, and thank you for the opportunity to present today. Today's progress update on the Community Safety and Wellbeing Plan is the first update that we're presenting to committee since it was approved in November of 2021. And with the approval of the plan, we saw that transfer of responsibility from our emergency and protective services under the leadership of General Manager Ayat to the Community and Social Services Department. And today we're going to provide an overview of the governance structure and the progress that we've made today. But before I do that, I want to take the opportunity to just thank staff for the incredible work and progress that has been made in the short time since that plan has moved over, but also the work that was done to lay the foundation. Firstly, I'd like to thank General Manager Kim Ayat, Lisa Petch and Leslie Charles, who were really instrumental in developing this plan with real engagement and consultation with both council and the community. And it really has laid the roadmap for the work ahead of us to develop a real community impact change. I'd like to thank Kim, Lisa and Leslie for all of their work and the solid plan that they put before council. And with me today is Sarah Taylor, who is our new Director of Community Safety, Wellbeing, Policy and Analytics. And Sarah will walk you through the elements of the governance structure that we've put in place that really is based on an evidence-informed approach to build governance for a collective impact plan that really unites the collective actions of community organizations, institutions, and leaders in our community towards the well-being of our community. The Community and Safety Wellbeing governance structure is the result of a thorough analysis of what structures make sense in a community impact way. It's a different way of working with the community, and we're really excited in this new approach and leadership role that the city will be playing with the community around the community safety and well-being. And we've seen overwhelming support from the community in terms of the efforts we're making to advance this governance structure. Also joining us today for the presentation, as Councillor Luloff introduced, is Dr. Claire Kendall, who's the Associate Dean of Social Accountability with the Faculty of Medicine at the University of Ottawa. She's also an Associate Professor with the Department of Family Medicine and a family physician at the Briere Academic Family Health Team, and holds a clinical research chair in strengthening primary care for integrated health equity. I'm really excited to be joining this partnership with Dr. Kendall. It's been an exciting whirlwind of activity that Dr. Kendall has been leading with the university, and our team has been working with in the city of Ottawa to build this partnership. And this partnership, what's really exciting about it is it will create a conduit between the community and the city and the university, and will allow students and faculty support the direct support to the community action teams and to the work overall of the plan. And they will do that through community service learning, extracurricular volunteer initiatives, internships, and research collaborations. This initiative is called City Studio, and City Studio Ottawa begins this innovative relationship so that it can connect and mobilize city students, faculty, and community members for collaborative action for our community's health and well-being, with equity really at our core. So Dr. Kendall is a great partner in this initiative as we move forward. And overall, today's progress update will provide you with the work that's been undertaken to date to fulfill Council's goals and objectives for the Community Safety and Wellbeing Plan. And it will help you understand and see the chart of the course that we'll take over the next few years. So thank you very much for the opportunity, and I'll hand it over to Sarah to go through the presentation.
Thank you very much, Donna, for those opening remarks. Thank you, Chair. As Donna said, today I'm providing you with an update on the progress of the implementation of the Community Safety and Wellbeing Plan, specifically the governance structure and the exciting new City Studio Ottawa partnership. I will close with the implementation timeline for next steps in 2023, and then introduce Dr. Claire Kendall, who will share more information on City Studio Ottawa. This progress update marks an important milestone in the implementation of the plan, which was approved by Council in November 2021. Before I begin, I would like to take a moment to thank the many community leaders of organizations and agencies who've been working with us and supporting us in the development of the governance structure for the Community Safety and Wellbeing Plan. I would also like to thank Lisa Petch and Leslie Charles for their hard work and dedication to consult, research, write, and analyze to get us where we are today. Next slide, please. As has been stated, the Community and Safety Wellbeing Plan is both a foundational strategy and a long-term journey that is intended to address the most pressing risk factors to community safety and well-being and respond to emerging issues that arise in the future. The priorities approved by Council are discrimination, marginalization, and racism, financial security and poverty reduction, gender-based violence and violence against women, housing, integrated and simpler systems, and mental well-being. Included in Council's approval of the plan in November 2021 are goals, strategies, and outcomes for the priorities, which establish their focus and direction. These will be used to develop detailed action plans within each area to drive social development to improve well-being and safety across all of Ottawa's communities. It's important to note that the successful achievement of the outcomes within the plan require a collective action approach centered in the voice and needs of community. This means it's not alone for the City of Ottawa to lead and act. We must work collectively across organizations, institutions, and agencies to see success. Next slide, please. The community safety and well-being governance structure is the result of a thorough analytical approach, including an environmental scan of other municipalities, a collective impact literature review, and consultation with over 30 community leaders. For the environmental scan, staff of 11 municipalities across Ontario were interviewed and provided information on their governance structure, as well as key topics such as incentives for participation and their advisory committee approach. The literature review included literature spanning innovative and leading governance practices with a specific focus on collective action initiatives that are grounded in community-led approaches with a broad range of stakeholders. And lastly, over 30 community leader discussions were held. During these discussions, staff asked for their experience, expertise, and advice on how to design and implement a governance structure that leverages the research and best practices within the local context. Next slide, please. In analyzing the information gathered through the governance development process, staff identified the following key themes, translating them into guiding principles for the establishment of the governance structure. This includes taking steps to align to the goals of Indigenous rights, racial equity, intersectionality, and system change to achieve equity, to create space for influence through integrating and amplifying the voice of lived experience, including those impacted by discrimination, marginalization, and racism, to ensure incentives for participation are aligned to the level of commitment, to include a search committee to guide recruitment and the selection process for membership, to avoid duplication, to create meaningful action-oriented meetings and engagements, and to allow for community-led approaches where feasible. Next slide, please. We are putting in place a governance structure that was developed through an evidence-informed approach and establishes the groundwork for the city to work with community in new ways, with continued oversight by the Community and Protective Services Committee and Council, as well as through a proposed council sponsors group sounding board. Overwhelming support has been received for the governance structure in its accomplishment of putting community, equity, and intersectionality at its core. The underpinning framework for the Community Safety and Wellbeing Plan is embedded in equity and intersectionality principles, aligning to the discrimination, marginalization, and racism priority. This supports setting the expectation that principles of intersectionality, equity, and the dismantling of systemic barriers are the starting point of the dialogue as the priorities move into action. The governance structure of the Community Safety and Wellbeing Plan will establish community leadership action teams who will lead the action planning and implementation for individual priorities, an advisory committee who will guide the strategic direction of the plan, a proposed council sponsors group to provide input, feedback on policy direction, financial strategies, and support championing the plan at other levels of government, and the Community Safety and Wellbeing Office to provide the backbone support for the plan. In addition to connecting the community leadership action teams with capacity building supports in required areas such as intersectionality and equity practices, data, performance measurement and evaluation, and finances. I will now go into details for each of these entities. Next slide, please. The community leadership action teams will be established for all of the priorities except for discrimination, marginalization, and racism, which, as discussed, is embedded within each. To date, the prioritization has been working in partnership with community, Ottawa Police Services, and Ottawa Public Health to establish the Guiding Council on Mental Health and Addictions. The Guiding Council is a strong example of this whole of community governance approach to tackling citywide priorities and the potential for what the other community leadership action teams can resemble. These action teams will be those institutions, groups, agencies, and businesses already working in the priority areas who are interested in working collectively to align current work while also developing new solutions. This will include engaging in ongoing dialogue with community, determining how each member will contribute, and working to collaborate and build partnerships, in addition to identifying how best to incorporate and amplify the voice of those with lived experience. They will report through the Community Safety and Wellbeing Office to the Advisory Committee and City Council as required. An initial call out for membership of the Community Leadership Action Teams will be developed through ongoing dialogue with community leaders. A process will then be administered by the Community Safety and Wellbeing Office using past practices of the city and with advice from the City Clerk's office where required. The timing of the launch of the Community Leadership Action Teams will vary by priority. This allows for time to consult with interested community agencies. In addition, the health and social service sectors continue to face a disproportionate impact due to COVID, with their ongoing emergency response and the pressure on staff they've had over the past 2 years. Next slide, please. A new advisory committee will guide the strategic direction of the plan, advising the other entities in the governance structure, and over time, bringing forward proposed changes as progress is made to City Council. Examples of this include bringing capacity building support and knowledge to the community leadership action teams with a focus on expertise in financial strategy, data, and legal, as well as leveraging their respective institutional resources. The advisory committee will also act as champions for the community safety and wellbeing plan within their organizations and across the broader Ottawa community. An advisory committee is required under the Police Services Act, Section 250. In Q2, a small selection committee will be established with community leaders and city staff. Following, an application process for 3 of the legislated membership roles will be launched, while ongoing conversations continue with leaders and represented sectors such as the Ontario health teams and education sector. Next slide, please. This slide outlines the membership required for the advisory committee as outlined in the Police Services Act legislation. Next slide, please. This slide outlines the additional membership we intend to include in the advisory committee. The skill sets represented through these roles are a result of the dialogue with community leaders in the development of the governance structure, as well as through the identification of critical knowledge and skill sets required for the success of the plan through supporting the community leadership action teams. Next slide, please. As mentioned, a council sponsors group will be proposed as part of the 2022 to 2026 governance review report to provide input and feedback on policy direction, financial strategies, and support championing the plan at other levels of government. Next slide, please. The Community Safety and Wellbeing Office provides backbone support as the secretariat to the Community Leadership Action Teams and Advisory Committee. This includes taking action to establish shared management practices, such as project management and key performance indicators, to schedule meetings and ensure timely communications, to cultivate community engagement and ownership, and to mobilize capacity building resources. The office will be key in coordinating the key coordinating entity between the advisory committee and the community leadership action teams, as well as being responsible for bringing in capacity building resources where required, such as for financial, data and performance measurement, engagement, and equity principles. The Director, Community Safety, Wellbeing, Policy and Analytics will play a liaison role between the leadership and chairs of each of the community leadership action teams. The director will also create clear lines of communication and build relationships required for supports, issues management, and cross-priority identification of opportunities. Next slide, please. An important element of the Community Safety and Wellbeing Plan is to leverage the significant work that is already occurring at both the municipal level and within community. Staff recognize that there are entities that currently exist that can support the work through resource capacity and building capacity. Examples of this include the Grantmakers Forum, City Studio Ottawa, which will be discussed in a moment, Ottawa Local Immigration Partnerships, Equity Ottawa Partnerships, and a proposal that's been put forward to the Ontario Solicitor General to pilot an interministerial funding table, which would be a locally focused cross-ministerial table with representatives from the Ministry of Children, Community and Social Services, Ministry of Health, and the Ministry of Municipal Affairs and Housing. We'd like to thank Councillor El-Shantiri for his leadership and support of formally providing this recommendation to the Solicitor General, and for having multiple meetings at AMO and Roma with the Solicitor General on funding for the Community Safety and Wellbeing Plan. The Community Safety Wellbeing Office will play an interface between these groups and the other governing entities to support them where required. Next slide, please. In closing, please see the ongoing implementation work and next steps with associated timelines for the remainder of 2022. Q2 will include continued research and leveraging the City Studio expertise in the development of the plan's overarching evaluation and performance measurement framework. It will see the setup of the governance through sector applications to advisory committee and an open call for the community leadership action teams for each priority. Following the establishment of the advisory committee and community leadership action teams, work will be undertaken to further define each priority's action plan. These action plans will be required to then inform the completion of the evaluation and performance measurement framework, as well as the basis for the financial strategy, which will be brought forward to members of council in Q1 2023. In addition, work will continue with the guiding council on previous motions and directions provided to the General Manager, Community and Social Services. A memo providing a status update on this work will be provided to City Council in Q2. Another memo will also be provided to City Council in Q2, announcing the recipients of the $2.1 million in project funding to community agencies. In Q3 2022, City Studio projects will be initiated. It is through the leadership of Dr. Kendall and Lisa Petch that City Studio Ottawa has launched prioritizing the Community Safety and Wellbeing Plan. To hear more about this exciting partnership and its timelines, it's now my honor to invite Dr. Claire Kendall to present.
Thanks, Sarah. Thank you, Chair, members of the committee, and Donna for welcoming me. I'm delighted to be here today to tell you about the City Studio model and how we'll be applying it here in Ottawa. Are you in charge of slides, Sarah? You can zip. Thank you. You can even go to the next one. Perfect. So I'd like to start just by explaining what a City Studio is. And a City Studio is really a relationship. It's a proven and locally adaptive and trust-based partnership model between cities, universities, and their communities. It enables municipalities and their academic institutions to collaborate effectively and efficiently. And it links a municipality's needs with the expertise and creativity of local researchers, faculty experts, and driven students. The first City Studio was launched actually in Vancouver several years ago, but the model now exists in 15 cities across Canada, Australia, and Oslo. You can move on to the next one, Sarah. Thank you. And how does this actually work? So City Studio works through what's called a project cycle. There's a coordinator who is specifically trained to lead the process and acts as a conduit between the partners. In Ottawa, that coordination role is going to be played by someone at the city in conjunction with someone at the University Center for Community Engagement, and that person is already in place and funded through the university. First, these coordinators work with city staff to identify priorities for action and to scope out projects to address these. Second, they match these projects to the expertise and skills of the students and faculty at the university. Next, the students, city staff, faculty members, and community members work together to develop the projects and then deliver the outputs. And at the end of the project cycle, every year, there's an event called the Hubbub to celebrate the year's success. And we've been lucky to attend some of those hubbubs and understand how these projects are working in different municipalities. And next slide. So City Studio Ottawa, our model, is really going to have a specific focus on addressing the priorities of the Community Safety and Wellbeing Plan. My mandate in the Office of Social Accountability at the University of the Faculty of Medicine at the University of Ottawa is really to align our activities and our expertise and skills towards the priority health needs of the community. So we felt this was a natural fit. While the Faculty of Medicine Community Safety Wellbeing Plan was the initial relationship, City Studio Ottawa is actually a multi-faculty initiative and is directly supported by the University Centre for Community Engagement, where, as I mentioned, the coordinator lives. Going to the next slide. And these numbers just show kind of the current experiential learning that's facilitated through the Centre for Community Engagement. So you can see, there are over 4,000 placements every year for students of different types. And then when you consider things like volunteer opportunities, are almost 10,000 for 2021. So it gives you a sense of the extent for potential collaboration for City Studio Ottawa projects. And we'll go to the next slide. And this slide is really to share with you the scope of these projects. So first at the bottom, City Studio could simply be a touch point for volunteer opportunities for university staff, students, and faculty members. But the main touch points are going to be at the other levels. So the second level is what we would think of as course-based or project-based learning. And this could come in the form of students working on city projects for their community service learning hours, or by conducting projects that help them obtain course credits. So an example might be that as part of her program evaluation course requirements, we currently have a student who's creating a logic model and evaluation matrix for City Studio Ottawa. In the Faculty of Medicine, all of our medical students do a community service learning course of a minimum of 30 hours. And for this year, for 2020, fall 2022, spring 2023, we've decided to allocate a minimum of 20 of those placements to City Studio Ottawa projects. The third level of collaboration is where students might have the opportunity to meet other requirements of their academic program, like a co-op placement or a practicum placement. For example, in May, we're going to have a Master's in Public Health practicum student who will be working with the Community and Social Services on the Community Safety Wellbeing Plan evaluation framework. Finally, I think that there's tremendous opportunity for bilateral and community engaged longitudinal research projects and capacity building. At the university, we have something called the Center for Research and Education and Community Services, and they're already really looking forward to providing capacity building for the city and community project partners in areas like program evaluation. And next slide will just give you one example of a research partnership. Sorry, it shows my name, but this is just one example of a great research partnership between the city and the Office of Social Accountability. So we are equal co-leads on this large CIHR, so Canadian Institutes for Health Research grant. It was $1 million to help us determine how City Studio projects actually improve the health of the community. We've also applied for funding, for example, to support the synthesis and reporting of Ottawa housing data with some of our community partners. And the Community and Social Services team. My last slide is just a bit about our timeline. So the first dot is where we are today. We have a project coordinator in place at the university and are working with Sarah's team on next steps. Next, City Studio is going to conduct the training with the coordinators and the broader executive team. We hope to have the conduit open for projects by fall, and we'll host an event to celebrate the launch around that time. We're already looking at scale and spread partnerships, for example, with the Northern Ontario Medical School and City Studio Thunder Bay. And as I mentioned, we've received some funding and we'll be helping to support evaluation of City Studio Ottawa. And I'd be happy to answer any questions, and thank you for inviting me today.
Thank you so much, Dr. Kendall. It's really great to have you out to make such a wonderful presentation today. I'm so glad to see this partnership. And of course, being home to the university, Councillor Fleury's ward. Councillor Fleury has some questions, so please go ahead.
Thank you, Chair, and thank you, Sarah, for your time a few days ago and your consideration. I'll come back because I do have a few points to that, but I do have a couple of questions for the partnership, and specifically, Doctor, there are a number of researchers at the University of Ottawa outside of the Faculty of Medicine who've actually done a lot and actually in some instances have been critical of the city and what I think is a very constructive way as academics, particularly in the Faculty of Arts, Psychology, Dr. Tim Aubry, for example, and Dr. Sylvestre, as well as Kevin Page at the School of Public Policy and Economics. So I'm very interested in what you're proposing, but I know the university to be a big beast of a campus and very complex to work among faculty. And I guess I'm looking for a little clarity as to how do other members who are conducting various research on housing first, on homelessness, on income issues tie into the lab, because I'm quite interested in the lab. I just want to make sure that it's comprehensive, and I don't know if there is an internal mechanism at the university to capture all of the studies that are going on that could be helpful in this agreement.
I'm delighted to answer your question. Can you still hear me? My earbuds just made a noise. You can hear me okay? Really excited to answer this question, actually, and I hope my response will be reassuring and inspiring. The first point that I really want to make is that the City Studio model will be a conduit for relationships that already exist, but the initial purpose and the way many other city studios run is that the projects are meant to come from the city. So they're not meant to be us and our necessarily, our academic world deciding what we think is best for the city and the community, okay? Having said that, while the relationship started with the Faculty of Medicine and our initial focus is a community safety well-being plan because that's something very tangible for action, as we know, the priorities do reflect issues like housing, gender-based violence, a lot of other areas that don't necessarily fall uniquely under the Faculty of Medicine. In fact, I would say that most health issues do not land directly in the Faculty of Medicine. They really revolve around the social determinants. Tim Aubry has been a major champion. He's a co-investigator on the research proposal we've submitted. And I've been in contact with Dr. Sylvestre as well. And we held actually in March a large cross-faculty meeting to get them interested and inspired by the City Studio model. We had 60 members attending that meeting. And we're also very familiar with the different places where community service learning is happening. And some of the people you mentioned have been involved in that, right? They have their people involved in activities. So we view this as very intersectoral. This is just sort of our launch point because we need something tangible to work from. A lot of the names are involved. We recognize that health is not narrow. And the advantage of having the city coordinator is that they also have these internal relationships with people within the faculty. There was one more small point I was going to make. And oh yes, I was going to make raise the important point that you mentioned about openness to criticism, right, of city and city activities. And that actually came up at our faculty meeting. One of the key questions was, how are we going to make sure that voices who may have been disenfranchised or have felt disenfranchised by activities in the past are welcomed into to the City Studio Ottawa space? And the City Studio Ottawa model is very much equity-based, and other models have been doing a lot of work. Some are much more embedded in Indigenous communities or cities where the Indigenous community has a stronger voice maybe than we have yet. So I am confident that we will be able to bridge some of those divides. My own personal work has been in community-based participatory research, a lot of that happening with the Proud study in your area. So I look forward to actually working with you and learning from you as we move forward.
Great, thank you. And Mr. Chair, I'm in your hands. I do have questions, comments for staff. So I don't know if I should come back onto the list for this item if other colleagues have questions to the university.
Sure, if you want to come back on, that's just fine, Councillor. It's perfect. Councillor Kavanagh, please go ahead.
Oh, okay, thank you. Yeah, thank you very much. This sounds very exciting. My question is about collecting data. That's usually how you figure out how you're doing. And so it's very important. So I want to know how that works and if there's intersectionality, because we have 5 priority areas. For example, violence against women and housing. And we're starting to look at mental health. How is that done? And are you specifically collecting on gender-based data?
Thank you, Chair, for the question. Specifically to data and with the data for the plan, there's 2 components. Is one, we're in the process of developing a performance measurement and evaluation framework, which will guide what data we're looking at, both from an intervention and action perspective, but also a broader, what we refer to as population health measures or population social measures. So more broadly, how is the Ottawa community doing? So we're in the initial phases of working and leveraging the City Studio partnership to bring in expertise to help us in the design of that evaluation. And one of the strategies within the integrated and simpler systems priorities is around data governance, specifically within the community. And so that'll be a project that we're looking to scope and define and further provide guidelines and recommendations around disaggregated data or the collection of that through the work as well and with our partners in the community.
I'm curious, we're all meeting virtually, and so it's easy for groups to get together. But where do you plan to meet when you can meet physically? Is it university at the university or at City Hall? I'm just curious.
Thank you for the question, Chair. I would say we're looking to meet all over the city and leveraging spaces within community agencies, the Innovation Center, the university, as well as City Hall, and meeting people and community where they are, not necessarily at our institutions.
Okay, so you're willing to do road trips. Great. Okay. Yeah. Count me in if you're interested in coming this way. Okay, thank you.
Thanks so much, Councillor Kavanaugh. Councillor Deans, please.
Thank you, Mr. Chair, and thank you for the presentation. You know, I've been quite involved in the Community Safety and Wellbeing Plan as Chair of the Police Services Board previously, and also as Chair of Crime Prevention Ottawa. And, you know, I really believe that this is a foundational effort for the city and that we need to get it right. And I think what we've seen today is all really important. I agree that we need to have a proper governance structure. We need evaluation and performance measurement. We need good data to drive initiatives. And I think all of the work that is happening behind the scenes is super important, and it's foundation. We need to do it. What I don't see, what I haven't really seen that I think is really important is the community facing piece, how we explain to the community what community safety and well-being means to us and why we think this is so foundational in terms of change. And other jurisdictions, other municipalities who have gone through community safety and well-being processes have developed documents for the community to say, here's what we imagine community safety and well-being. In the past, it's been a lot about policing, and it's been a lot about response after the fact. And what we see in community safety and well-being is we've added well-being, and we're working to break down silos throughout the municipality and to respond differently and to have, I think, a better response that would be more responsive to the community and will address differently people who feel that they have not been well served in the past. And our most vulnerable citizens, I think we could all agree we could do a better job in meeting their needs and making sure that the well-being is in the community safety and well-being piece. And so I guess I like everything you're doing here. I guess what I think that we need, and maybe it's partially the council sponsors group, because maybe it's more of the political piece, but I think we need to frame out, and I think we need to create a document for public use, and maybe a little bit of a traveling roadshow about community safety and well-being, and sort of communicate with the community what community safety and well-being is, what the change is, how we see breaking down silos across the city and with our partners and the universities and everyone else to find a better response in our community to better serve all of our citizens, including our most vulnerable citizens. So I don't know, Donna, if you want to just comment on, if that, when that happens.
Thank you, Mr. Chair. And maybe I'll start and then have Sarah also speak to some of the details, because I think it's a really important piece around the collective understanding of the priorities of the plan and how we're going to move forward. And the team has been really thoughtful in these early stages of, before we're kind of out communicating it in its entirety, is really listening to help people and having a dialogue and discussion about the intent and the meaning of the plan, listening to what's important to the community that we need to include in the governance and the structure, and how they want to be engaged and how they want to be communicated. And that, as Sarah said, we've been out informally, which is probably what you haven't seen as a broad communication. It's been more an engage and a dialogue. So, and we've been trying to be really non-traditional in our approach to do that. And a good example, or one example of many, was we convened a Black Leaders Forum, where we did a call out to Black leaders in our community to just have a discussion and dialogue about what's important in the plan for them, what they believed we needed to consider when looking at the governance structure. And that first discussion, and we've done that in multiple forums with the Ottawa Local Immigration Partnership, the Community Health and Resource Center Partnership. We've been doing that vastly to everybody to talk about, will this structure meet the needs and what's important. Now that we're really seeing, as council has endorsed the government, we have a plan, we have a governance structure, we're starting to mobilize the community to come and join us in partnership with the university, who has started also to communicate. We're going to now do a communication strategy and plan that will really look at a combination of just not one-way communication, but continued dialogue and conversation. And we're starting to pilot some really unique ways of having dialogue and discussion with groups who wouldn't traditionally go through our regular communication channels. And so we're really doing a combination of engagement, communication, marketing, information sessions as we start the process to move out. Because we also really want the action teams, when we do the call out for the action teams and we bring the action teams in, and they start to be the conduit of information as well. The community becomes the conduit of information into the community. So you will start to see that this year as we start to roll out this program. On the website right now, there is a pretty good kind of placeholder of information of where we've landed today in terms of the research, the report, and we will continue to do that as we move through the governance process. Sarah, I don't know if you wanted to add to that.
No, thank you, Donna, and thank you, Chair. Donna, you covered it well in terms of the communication strategy. I would just add that of the FTEs that Council approved permanently for the Community Safety and Wellbeing Office, one will be that we're in the process of hiring for is a communications and outreach coordinator, given the importance of this work as described both by Councillor Deans and Donna. Thank you.
Okay, thank you for that. And I think that's really important. I mean, for my own communities, I would like them to be so familiar with the term community safety and well-being and know what it is, know what it means, and feel that they're part of it, that it just becomes part of us as a city. And I don't think we're there. Like maybe when we hire the person that Sarah was just referring to, then we can get out into communities and dialogue with community associations and with groups that are doing really important work on the ground, especially in our vulnerable communities. I think about the community of Heatherington that I represent. I would love them to be part of community safety and well-being and feel that they were part of it and had input into it and were providing input to the city on what they need to serve them better. And so I think there's some work to do in terms of that outward looking piece into the community. And I know we're early on and we've done a lot of consultation. We've worked with a lot of groups, and now I think that there's somewhere along the line we have to get it into the communities, and it has to be a term that everybody understands and embraces in the community to really make it a success. That's all from me. Thank you.
Thank you very much, Councillor Deans. I see Councillor McKenney has their hand up. I'll turn the floor over to them.
Thanks. Thank you, Chair. Thanks, staff, and Claire Kendall for the presentations. No doubt that there's been a lot of work that is gone into this since we adopted the Community Safety Wellbeing Plan, and good to see how we've moved forward in the. I think that really it's encouraging and you know, the sort of the insight and the work we'll get out of the city hub. Congratulations on that partnership. I really do look forward to the outcomes there. I do though want to talk about you know, when we, you know, I look at why we're here, why we you know, even you know, required a guiding council for mental health and addictions. And it's quite clear that it's a result of, it's right here in the document, consistent chronic underfunding of mental health and addiction services, you know, over 40 years. So I guess my question is, you know, when do we see these investments back into the community? You know, I represent also a part of the city where, you know, we have a need for alternate interventions for community members who are, you know, suffering from poison drugs in our community. Homelessness, poverty, and today much of the response to that comes from police services. There's nobody else to call, and we know what we need. You know, we have models of collective impact. You know, we could establish that in this community. It's been done elsewhere, and what's standing between the issues in the community where people are suffering and better outcomes is funding. We know what to do, but we need the funding. So I'm just wondering, I guess, or asking, when are we going to start to see actual outcomes? When are we going to see a significant funding of mental health and addiction services and social services? But that's where the, you know, good friend of mine who's been around for a long time always says to me, Catherine, they tell you it's not about the money, you know, it's about the money, right? So it really is. And I get you need the research and the background and the guiding councils and community involvement. But, you know, in the end, we need significant funding in the mental health social services. So I guess my question again is just, when can we expect to see that type of outcome where there will be a difference on the ground for people who are in the community and not doing well?
Thank you for the question, Chair. In terms of the financial component, so while the Community Safety and Wellbeing Plan is legislated, the provincial government has not associated yet any funding with it. And so we're approaching the funding question through a few different means. One, through the action planning and examples such as the Guiding Council or the Lower Town Byward Market and Sandy Hill Mental Health Strategy, of looking at specific interventions that then we can request funding around. In addition, as mentioned, we'll be working on a long-range sustainability financial strategy, which will come forward in Q1 in 2023. In addition, we thank Council for their investments in the community through the $2.1 million 3-year project funding, which the allocation process has recently closed, and we'll be announcing the successful agencies in Q2. And those are for projects that are already up and running and have a proven track record, but needed additional resources or support for scale and spread.
I appreciate that, and I appreciate the work that staff is doing, but I think that, as we're working through this, we also have to be honest with the community out there that there is no funding attached. This was, put upon us by the provincial government, and absolutely no funding. Yes, we did as council provide $2 million for some ongoing projects, but I cannot go back today to my community where people are suffering and I need help. And we need to be able to access some funds so that we can come together as a community to ensure people do well, that they stay alive, and that the community is healthier as a result of, chronic underfunding of community and social services. So I think we need to be more aggressive, and I think that we need to be more forthright in acknowledging that provincial partners and council are not properly funding mental health services and community and social services to the extent that we need to. We know what we need to do, but we don't have the funding to match it. So I do look forward to future conversations about funding. Thank you.
Thank you, Councillor. Vice Chair Aguilera, please.
Thank you. Hello?
I think we can hear you now, Vice Chair. You're a bit shaky on your connection.
Sorry. What I said is I thought that Councillor Fleury was ahead of me on the list.
He came off to let you go ahead.
Oh, okay. Thank you. I don't have any questions. I just wanted to say thank you to Donna and the team. As Vice Chair, I've had numerous meetings with Donna and with Sarah, and the work that has been done in such a short period of time, I think is truly impressive, and shows a real commitment to getting this project off the ground. And I'm sorry that Councillor El-Shanturi isn't here, because he's been a fierce advocate to the other levels of government to get this project moving, to the funding for the project. But I did want to take this opportunity to give kudos to staff, because I've been watching this very closely, meeting with staff, as has the chair, and again, the amount of work that has been done in a very short period of time to get this project on the road, so to speak, has been truly impressive. So I think that needs to be noted. There's a lot of work left to be done, but in all my discussions with Donna and Sarah, they've acknowledged that, they know that, and they're in here for the long haul to make this project a success. So I think we're getting lots of good feedback today from councillors as to where we believe things need to be added to or amended. I've seen Sarah furiously taking notes, and so I'm very helpful that we're on the right track, and staff for bringing us to this point.
Thank you very much, Vice Chair. Councillor Fleury on the second round, please go ahead.
Yeah, thank you, Chair. And I wanted to come back to maybe ask a few questions specifically for staff. And Sarah, I don't know if you're in a position. I guess I'm coming at it from the lens of being chair of Ottawa Community Housing. We're Ottawa's largest landlord, but we also represent many of the most vulnerable communities, most diverse, lowest income. We work with 200 partners already. So curious to see what is the role of OCH in this agreement and going forward. I certainly know we're a stakeholder. I know, for example, Brian, one of the vice presidents, is at the table, but I'm more curious to see how we're embedding some of those efforts, because I do see chronic vulnerabilities amongst the communities of Ottawa Community Housing, and I think the effort here is if not entirely, a majority of it is specific to many of those communities as well.
Thank you, Chair. I've had the pleasure of meeting with the team at Ottawa Community Housing a couple of times, and they bring a great, not just to what you said in terms of proximity to the clients, but a great breadth and depth of skill set and knowledge and expertise. And where that's best placed and leveraged is within the community leadership action teams, which are the groups that are really going to be driving action planning, solutions, looking to test different interventions and see progress. And so the hope is that they identify and participate in all of the priority action teams where they feel they have an opportunity to contribute. And I'll have ongoing discussions with them around timelines and provide that proactively to Stefan and his team to make sure that they're engaged.
I'm always very open and constructive in being aware of the challenges. Stefan and Brian and so on are very good and try to do what they can for the organization. There are 200 partners who know, and there's 15,000 residents. So I wonder, using the physical distribution of OCH in communities, how we plan to get, we have a great partnership with OCH. We're obviously an important partner as a city of the organization, but beyond that, how do we get to the tenant who feels unsafe, who has particular challenges? I guess that is the barrier that I still see. I'm not asking you to engage with 15,000 residents, but I am concerned that we're having a conversation with OCH leadership feels as if we're talking and understanding the full length of some of the well-being and safety challenges, and I would caution us there.
Thank you, Chair. While the priorities, the Community Safety and Wellbeing Plan outlines 6 priorities with goals, strategies, and outcomes. At this point, they remain at high level. So as an example, within the financial security and poverty reduction, the specific activities are to develop a poverty reduction strategy and to develop a food security strategy. So there's additional work, a key component of that being engagement with the individuals that the counselor is referencing as a next step. And we're looking to bring in new and innovative ways to engage with community members and to build trust and use engagement methodology called deep listening, which is being run out of a think tank called Monumental at the University of Toronto, which has seen great success and some engagement mechanisms that they've put in place with the City of Toronto. And we're in ongoing discussions with them around how we can bring and test some of those practices here in Ottawa. And so the underpinning of the governance around an equity and intersectionality lens and the guiding principle of bringing forward and amplifying the voice of those with lived and living experience is a key component of the work and will be needed as we move forward in developing all of the action plans.
Okay. Well, yeah, appreciate your openness and creativity and using new models to engage. Donna, maybe to you on as council heads into its last leg, we have legacy committee structures based on priorities of a certain time, and I'm looking with this renewed effort and attention. I know Councillor Deans was speaking earlier about crime prevention, and I sort of feel that this group it has a really a leg of its own, yet with very similar stakeholders, school boards, OCH, a number of the partners. And I wonder, you might not have the answer today, but I wonder if you could advise committee and clerk as to how to next term look at a governance structure for guiding council, crime prevention, CPS, that looks at the safety, well-being, because I do think that those are some of the fundamental pillars, and our governance as council will need to adjust to our new priorities, I guess, which have become quite obvious now.
Thank you, Mr. Chair. And as Sarah mentioned, a piece of the governance, particularly the sponsors group, will go into the governance report that will be one of the first activities that the new council will review in terms of the setup of the next governance structure for the term of council. And in addition to that, we have been directed to look at a variety of aspects around some of our equity strategies. And those are going to be recommendations as well that will go into that governance report. We really have seen crime prevention to date and the mandate of crime prevention as being a distinct and unique mandate and role to play, and an important role that they will play in a number of the action teams moving forward. But really, any governance structures that or changes that council would like to see made would be inputs into that next term of council governance report. So that would be the opportunity of councillors to direct any reviews or changes in governance structures that that you would see or want to be reviewed and looked at.
Okay, I hear you. Maybe we could take it offline because I'm intrigued to see. Yeah, I think there are some obvious ones like Ottawa Public Health, OCH, those have to remain as boards, but I think as members of council looking at other mechanisms, and Chair, I'd love to maybe engage with you on that, because I think with the safety and well-being plan, with the pillars, maybe it becomes a working group of CPS or something. Anyways, probably gone too far in the governance, but I do think that there is a unique opportunity for our own committees to renew, to reflect some of these priorities.
As always, Matt, happy to chat for sure. Any further questions on this item or comments? Is this item received? Received.
Received.
Okay, we have a request for Councillor Fleury to hang on to items 2, 3, and 4. Therefore, I'll now turn it over to Saeed to make a brief presentation on these 3 items. And then we can do, because the presentation will be on all 3 items as they are very interconnected, we'll have questions and comments on all 3 items at the end, and then go through the 3 for a vote after. So you
Thank you, Chair. I'll wait for the presentation to be uploaded. Okay, good morning, everyone. My name is Saeed Saya. I'm Acting Director of Housing Services. The 3 reports that are before you today involve 3 significant provincial programs that are administered by Housing Services. The first is the Canada Ontario Housing Benefits Program. This is a portable housing allowance that can be provided to families and individuals. The second report is about the Canada Ontario Community Housing Initiative. This is funding primarily all for community or social housing providers, and I will speak to that in a moment. And the third program, and the bulk of the funding, and described in the 3 reports, is the Homelessness Prevention Program, which is the combination of 3 existing programs that the city currently administers on behalf of the province. Next slide. So with respect to these, they've got all different funding envelopes attached to them. The first, with the Housing Benefits Report, which is slightly above $3 million. This will assist approximately 400 households and individuals obtain housing. The second report, we're looking at $14 million to be spent this fiscal year towards repairs to social housing. And the third report, the Homelessness Prevention Program, where I'll spend a little bit more time, And this is the biggest part of the funding envelope, and the biggest piece of funding of the three reports is $47 million, $47.6 million, the bulk of which comes from the previous Community Homelessness Prevention Initiative. Next slide, please. So to start with the COB, this is the third year that this housing benefit has been allocated to the City of Ottawa. We've seen a steady increase in the funding year over year. And with the funding that we expect to receive this year, like I said before, we expect to assist or house approximately 400 households. With respect to priority groups, we have made some slight modifications to the priority groups that we're recommending to receive funding. First is survivors of domestic violence and human trafficking. This is both a provincial priority and a city priority. The second is households with children at risk of homelessness and households experiencing homelessness. So this is going to allow us to go slightly outside of the emergency shelter system to possibly prevent homelessness from occurring in some instances. But we have to keep in mind we do only have 400 benefits to provide. The third criteria or the third target is seniors and persons with disabilities. Seniors, we do place frequently from the centralized wait list and out of the emergency shelter system. And with respect to people with disabilities, we are recommending a pilot program with Developmental Services Ontario to move some individuals who are living in supportive housing into permanent affordable housing, freeing up more supportive housing units within that part of the sector. And then the final, and these aren't in any particular order, but the Indigenous persons, of course, are also a priority with respect to allocating the housing benefits. Next slide, please. The second report is really refers to the Canada-Ontario Community Housing Initiative. This is a continuation of federal and provincial funding into social housing. It partially makes up for lost federal subsidies going into our social housing portfolio. And it's what the community housing sector relies on mostly for capital repairs, in addition to city funding that's provided through the HHIP. Over the last 3 years, we've received $21 million for capital repairs, and we've allocated $2.1 million for transitional operating funding. And what we mean by transitional operating funding is funding to allow the community housing sector to modernize, to form partnerships, to see mergers, etc. This year, we're recommending a similar ratio to allocate the funding, the $14 million that we're receiving, $12.3 million to go directly into community housing renovations. This funding will be prioritized based on urgency of renovations, and then we would look at other things such as accessibility and need. But as you're well aware, we do have more renovations needed than funding that's typically available. We're recommending that $1 million be set aside for transitional operating, and this again is to help modernize the social housing sector and to assist in the formation of partnerships and other leveraging or merger opportunities that may present themselves. And lastly, an administration piece as well to assist the city in covering its cost of $700,000 for administration. Next slide. So the homelessness prevention program, this is where we've seen probably the most amount of change between among all the provincial programs that are before you today. The objective of the HPP is to support Ontario's 47 service managers in preventing, addressing, and reducing homelessness. What the HPP is, as I mentioned earlier, is a combination of three existing programs. The first is the Community Homelessness Prevention Initiative. The second is the Home for Good program. And the third is the Strong Communities Rent Supplement program. And in the image there, you'd see additional funding being added by the province. Now, these are provincial-wide numbers in the image. So an extra $24.7 million is being added to the provincial pot. And if you can go to the next slide, please, we'll break down City of Ottawa's contributions. So when we look at our previous year's allocations under these three programs that have been combined, we received 38 million, 38.6 under the CHIPPY program. A lot of this you might be familiar with because it goes to supporting the operation of our community shelters, as well as supportive housing and other homelessness-related requirements. The second program, the HFG, is the Home for Good program. The vast majority of these funds are used for housing benefits and supports for persons exiting the shelters or people who need supports in affordable or social housing. And these program funds are dedicated there, and they're currently fully allocated, and they revolve year after year. So we do count on the province to renew these funds annually. The third program is the rent supplement program of 2.6 million, and this has been in place for more than a decade as well. So when we add the total of these three programs, we're looking at $46 million. Now that they've been combined into the new HPP, we have a total of 47.6 million, which gives us an extra 1.5 million to allocate. Next slide. So it looks like a big announcement, but it's a modest increase to our existing budget. And while we're making some operational changes to how the funds are spent with the agencies, for example, within the community shelters, we're moving to block funding agreements, which allows us to move to a more outcomes-based approach with respect to providing supports and assistance to homeless individuals and families. We are looking at ways to use this additional 1.5 million a little more, I would like to say uniquely, but I'll just lay it out here for you. So 216,000 for administration. We do want to allocate up to 830,000 to stabilize the front line of the community sector. When we look at shelters and support service agency capacity, it's been negatively impacted by the pandemic. A lot of staff have left the sector. There's been a lot of movement, and we know that we have to work with the sector to strengthen those frontline services. So we're looking to allocate approximately 800,000 in that specific area. We also want to increase supports in social housing and caseworker support for families. And so with a part of that 1.5 million is to create additional caseworkers, basically, so that we can reduce caseworker loads, have more individuals receiving case support, and that helps us support them more effectively and house them more quickly. Next slide. So just to quickly summarize the key outcomes that we're looking at among the three programs. So with the Canada-Ontario Housing Benefit, these are new housing benefits, 400 new benefits that we hope will make somewhat of an impact on the number of individuals staying in shelters and on the centralized wait list. One important part to note is that households can move anywhere within the province under this benefit. So once they receive it, they do have some degrees of flexibility to keep the benefit if they choose to move to another part of Ontario. With respect to COCHI, this falls within our 10-year housing and homelessness plan's objective to keep community housing in a good state of repair. So $12 million towards renovations. We've already started working with the community housing sector to allocate these funds and expect to have renovation projects up and running fairly soon. And then $1 million in transitional operating to improve sector partnerships and efficiencies. And then thirdly, with the additional funds under the HPP, we're looking to stabilize the frontline community sector staffing capacity, increase supports in social housing, and increase caseworker support overall for individuals and families in the homelessness system. And that brings me to the end of my presentation. Here for questions.
Councillor McKenney.
Thank you. Thanks, Chair. Thanks, Saeed, for this. All three reports. Lots of information in there if people are interested in understanding the housing homelessness emergency that we're in. Saeed, I just want to circle back to the homeless prevention plan and the housing benefits. With the 400 new added benefits, what is the number that we're at? Like how many housing benefits are we able to provide into the community annually right now?
Councilor, I'll have to get that number from staff. It's I'm thinking it's above. It's around 3,000 right now between rent ups and housing allowances. Last time that I checked, so this would help us increase that. And also for the HPP, there's a modest increase. We are trying to increase the number, but it should be around 3,000.
Right, and just in the last 2-3 years, how many new benefits have been added? Do you know that?
Yeah, it seems to fluctuate from year to year, Councillor. So I think last year, 200 to 300, it was a lower amount. So it does depend greatly on the funding that we receive from the provincial and federal governments. Yes.
Yeah. Okay. Because I just want to point this out again. I'm going back to the money, but and this is no fault of our staff, but the federal National Housing Strategy, one of the goals that they impose on cities is to reduce core housing need over 10 years by 50%, right? So that would mean in Ottawa, our core housing need is, so households who are living in core housing need, so they spend 30, 50, up to 70, 80% of their income on housing and are always at risk of falling into homelessness and do fall into homelessness. That's why we can't end this emergency. 36,000 households in our city live in core housing need. So just the math alone, if we were to meet the goal of the National Housing Strategy in 10 years, we would have to provide housing benefit. And most of it, for those 36,000, I mean, we could build community housing, it would be the best thing, but not likely going to do that, right? Like that funding is not coming from the federal government. So what we need to do is provide them housing benefits so that they don't fall into homelessness. So 36,000, so 50% of those is 18,000. So over 10 years, we would need new housing benefits, 1,800 a year, 1,800 a year. So I just want to point out again that we are getting a fraction of what we need from the federal and provincial government to meet core housing need. So families and individuals, households are falling into homelessness at a much faster rate than we're able to house. So you know, we're not getting the funding that we need to build the community housing we need, and we're not getting the funding that we need to keep people from falling into homelessness. So it's important to remember that, and it's important to continue to pressure the federal government to meet its commitment on the National Housing Strategy. It has not done so. Our provincial government has not done so. They haven't done anything on community safety and well-being either. So 400 new benefits, good, but we need 1,800 a year just to meet a 50% reduction of people who can't feed their children properly, can't send them to school, dress properly, can't buy them school supplies, can't do the things that, you know, and food is getting more and more expensive. I was, you know, at a community center the other day with a lineup in Hintonburg, a lineup of people around the block at Hintonburg Community Center trying to get lunch on a Friday and some fresh fruit and vegetables. So again, I just want to point out that we need to keep in mind here what the numbers are, and that we are falling more and more behind, and we will continue to unless we put pressure, real pressure on the federal government and the provincial government who have the funds and are not prioritizing housing and homelessness. So thank you, Saeed. I always appreciate your reports and all the work that you do to try and stay on top of it with a severe lack of funding. Thank you. Thanks, Chair.
Thank you, Councillor McKenney. Councillor Fleury, please.
Thank you. Me too, Saeed. I'm really thankful for the presentation. My questions are in no means a challenge to you. It's just to better understand what's being presented. So So just so I'm clear on, I've prepared my notes for each report, so I'll sort of jump that way, if that's okay. So for the Canada Ontario Housing Benefit, the additional 400 households, that brings us to a total of what in 22? I was unclear by the report where that brought us as a total amount.
Yeah, so Councillor, it's always a challenge for counting all the different types of benefits we get. I am looking at some stats here, and if I look at the total number of RGI housing that's available, it's about 16,500. We've got 3,000 plus rent supplements sort of in play at any given time, or just over 1,000 housing benefits. So that brings us to 20,585 truly affordable housing options, if I use your language. Then we'd be adding another 400 to that with these housing benefits.
If you have that handy, I'd love for you to be able to share. I think that's an interesting set of stat there, what you just described, the 20,000 and the breakdown. On page 4 of that report, sort of an allusion or some reference to priority groups. Can you clarify for the record? I mean, this committee's done a lot of work to ensure families are prioritized. Is this group prioritized? Are the families prioritized in this group? And because later on page 11, you made reference to the wait list, and then that 36% of those on the wait list are kids. So I'm worried. I think that should be our top priority.
Yes, Chair and Councillor. Homeless families are prioritized with the housing benefits. Currently, the way we've been operating is even when we were technically at our limit with what we can allocate, we still make the benefits available to families in the shelter system. A challenge is convincing the families to take the housing benefit. And there are a number of issues with those. I did speak to a number of councillors weeks ago about some of this, but while we're not changing the rules now, we have reached out to the province to talk about changing some of the rules to the housing benefits to make them a little more attractive to those households. But we continue to make housing benefits available to all households in the homelessness system, households with children, that is.
So the short answer is families' priorities, yes.
Yes. What we're also doing this year, councillors, we want to open it up to some of the singles in the homelessness system as well, in particular to some of the singles in the PDCs, what we will call lower acuity clients, to try to ease some of the pressures that we're seeing there as well. But this will not take away any opportunities for families who are currently in shelters or motels.
Okay. On the, I guess just the last point for that report, do you have one of the key metrics that I see specifically for families to be successful to access this is kind of a complete set of package, first and last month. Also, what would be covered under a head lease environment? So I know it is in your work plan. Are you able to confirm that your team will be able to come back to committee this year with a program that advances head leases?
Through you, Chair. We have been exploring a head lease opportunity with landlords and landlord associations. It is challenging to bring landlords on with respect to a head lease, just because the market seems to be very favorable to landlords right now, and we're basically told that there's very little interest given the high rent that they can command from their units, and relatively speaking, low vacancy rates. Even though we see higher vacancy rates now because of new rental units coming online, these are still very expensive units, which drives up rent in even older units as well. So it's difficult to bring landlords on, but we're still looking and trying to pursue some of those head leasing or block leasing opportunities with landlords and the sector.
Just so I'm clear, because I do think that we have a bit of a stickler on how we feel about head leases. To me, head lease is not our ability to confirm a relationship with a landlord. It is the mechanism by which the city or a non-for-profit is structured to bring first and last month, to sign the lease on behalf of the tenant, to have capital repairs or unit damages repair. So it is less so confirming landlords, but more so the enabling tool.
Through you, Chair, you're correct, Councillor. We do have to do a better job with some of those things, bringing some of the different programs together. We do work to offer first and last month's rent, and we are looking at ways to provide or to improve sort of a rental repair bank or something along those lines for landlords as well, in case there's damage to a unit.
My personal position is that I still believe that is better done. I'm not sure that there is a non-for-profit equipped today, but I do feel that this program, the head lease program, would be better managed outside of the city, because if not, we're sort of double playing and it gets complicated quickly. I'll move on to the COCHI report, and just one or two questions there. So on page 13, there's a reference to RGI, and I'm looking maybe for a little clarity on our RGI. So we have a total assigned to Ottawa, and now those are city funded. I think they're about 80 million a year. We had requested that the province upload back those historic programs that now we're left covering for. Because we're managing it locally, have we not been able to make the RGI a portable sum? Because we make reference to there are families, particularly who move in and out of market rent, but are in a RGI unit. And I wonder if you have statistics on, at any given time, an RGI unit that is not going to a family in need of that allocation.
Councillor, with respect to RGI units and tenants staying in RGI units and paying market rent, there's two things that we've done. We're moving to a more portfolio-based approach to allow housing providers, including OCH, to move their RGI units, around within the portfolio. So this helps prevent that, prevents RGI units from being blocked and being accessed by residents who prefer to stay. In some cases, yes, a family, even though they may lose their RGI subsidy, they may choose to stay living in that OCH unit paying market rent. And there's lots of reasons for this. It could be the school the children are going to, but also the market rent might still be more affordable than the market rent in that neighborhood for another unit. So in that case, it does work for the household and in some respects for the community housing provider as well. But I do see your concern where, it does prevent another RGI unit from becoming available. Right now, though, I don't think we have a lack of units with respect to placing families within RGI. So I guess what I'm trying to say is I think we have a small surplus of RGI units, mainly because we have some units right now in commission being renovated, being rebuilt, for example, that includes OCH and some other providers. So it's not a big issue, but it is something we do continue to monitor.
Would it be possible to consider, we've seen the transition in childcare services, right? Where the subsidy used to be in the childcare and then the subsidy went to the parent who then was able to move. Because I think the current model, your description is bang on from what I've seen at OCH, so I'm not at all challenging that. But if a family is comfortable in a unit and becomes to pay market rent, that is a form of success. It means that the income level of that family is increasing, and if the housing is able to stabilize the family in terms of employment, in terms of schools, as you described, that's certainly not a bad thing. But then the subsidy sort of sits awaiting their need, and I guess I'm saying, at what point do we make a decision to say, okay, stay in your unit, but we're taking that subsidy and we're providing it to a new family? Terms of the RGI, I'm just curious to see to understand what the opportunities that are there.
So Councillor, maybe we could discuss this further. It's my understanding that we have that opportunity now. We do allow the housing provider to give that RGI subsidy to another family, while the family in the original unit is still paying the market rent. Right, the rent will increase and they will pay the full rent. That's my understanding. But maybe there's something that I'm not understanding.
Take it offline. Maybe I'm reading it wrong, but I'd love to understand it. Thank you. And that's exactly why I ask questions, is to better understand. Just to finish up on that report, and Chair, I see you've given me kind of notice here, so I'll come back for the final report after. On page 15 of the report, Saeed, I'd love your comment. So out of the 60 or so housing agencies in Ottawa, there are $30 million worth of capital repair asks, of which it says right now we're only funding 2.4. Is that accurate? I've seen different figures. I guess maybe OCH figures are challenging me here, but can you maybe speak to that specific point in your report?
Yeah, Councillor, there's different ways to measure the capital need requirements among the sector. So when we look at longer term requirements, the number could be very, very large. And when we look at shorter term requirements, it can become smaller. I think, at the end of the day, there is a shortfall in funding for repairs, and we are investing in asset management software. We've done this for about a decade now, and we're working with the sector to get a better handle on the what we would call the deferred maintenance. Things that can be put off, items that have to be repaired more urgently. And what one measure is that we do issue RFPs, REOIs, things like that to the sector, so we could gauge more immediate requests and needs. So often we'll get requests for funding for repairs that exceed what we have. But if we go through that list in detail, you might see, okay, replacing, putting new asphalt down in a driveway, is that really considered urgent or not, right? That might have a $1 or $2 million price tag. So it's really about prioritizing things and understanding what needs to be done when with the funds that we have. But that's not to take away from the argument that there is a shortfall with respect to repair and maintenance in social housing.
So the figures provided on page 15, the $30 million worth of ask for this year, and we're only funding 2.4, are accurate?
Yeah, the 2.4, I believe that's out of our HHIP. So this additional funding will go towards that $30 million worth of asks.
Feel free to hop back on, Councillor, no problem. Councillor Kavanaugh, please.
Thank you very much. One of the questions I had was in terms of the shelter and the changeover for block funding. I just wanted to get the reaction if this will be very helpful, or do you see it as a concern?
Okay. Thank you, Chair and Councillor. We've met with all the shelter providers over the last 4 to 6 months, and we're in the process now of signing block funding agreements. We've signed a number of them already. I think the reaction from the shelters has been positive for the most part. I mean, they did have some concerns about moving to block funding, but the idea with the block funding is that we don't want to financially penalize shelters for moving people out of shelter and into housing. I think we're going to have some challenges, or we'll have to look very closely at how we measure outcomes with the emergency shelter sector. So again, it's not that we want to penalize them or anything like that, but we do want to ensure that we're all properly engaging with clients, making sure that supports and benefits are available to them in a timely manner, and we have a good integrated system to offer them housing options. But I think it's a very positive step, the block funding approach, and so far, the entire community shelter community they've been very cooperative with this move.
Yeah, no, I can see that it would be great to have guaranteed funding. I guess the only concern is if it gets overcapacitated and the funding still stays the same, that would be a problem, particularly for services, because you need more social services sometimes, and if that's all part of the block, that would be the concern. But I guess we've all expressed our concern about money going to shelters rather than the housing. So hopefully it will help us get away from that problem of putting money into the shelters and then not putting the money into affordable housing, which is what we really, really want. And I think everybody does. I wanted to know, in terms of the funding, are you getting anything yet in terms of news or for the Rapid Housing Initiative from the feds? Anything? Because this is all provincial, right? Most of what you're talking about here. Do we have any news yet?
Through you, Chair, no, there's no news other than what I've read in the CBC news article about the
okay, so it hasn't come down to that level yet. Okay.
No,
okay, I think that would be a big part of it to see it. Yeah, no, I guess we're all concerned in terms of that type of funding and if that could make a difference. But we don't have news. We don't have news. Thank you very much.
Thank you, Councillor Kavanaugh. Councillor Fleury, please.
Thank you, Chair. And I'm coming back on that page 15, capital repairs. So, Said, I do want to express that I believe a lot of this is about capacity and an ability for a housing provider, and want to reassure colleagues and the public that Ottawa Community Housing, when the city or when governments provide capital repair funds, we know exactly where that dollar needs to go, and it's not kind of a thing of the wind here. We've invested heavily on retrofitting of our buildings and various systems for the portfolio. So, but I am intrigued, Said, for other housing providers, particularly small ones, as they have aging stock, what not meeting their capital repairs means. And I'm trying to get clarity from you. For us to only fund 2.4 out of the $30 million asks, what's that future risk? I mean, cost of materials, cost of construction keeps going up. So just trying to get an understanding of what you see in the figures that we're presenting on page 15.
Council, the risks for smaller providers can be quite severe. We've seen just over the last 2 years some very critical repairs that had to be done quite urgently for smaller housing providers. I think the city often steps in, or we wait for funding such as COCHI to come in and fund those. And in the meantime, we provide assistance. We do have a technical assessor on staff. We work with the agencies to conduct whatever types of building audits or engineering or architectural reviews or studies that have to be done to arrange for the work to be completed. But we do try to, again, through funding such as COCHI and over the last 3 years, to allocate funds to those most urgent of situations.
Okay, and then the final point on, I do think on that matter of capital, council needs to wake up to funding these and other governments as well, because if we're not investing in the existing stock, it's going to be problematic on a number of fronts, including loss of units. And I'm not threatening OCH here, I'm saying the other providers. I think OCH does have a plan with city staff. On page 17, Said, I quote, we're trying to incentivize housing providers with expiring operating agreements. I just want to understand that a bit better. So we have agreements. A lot of the providers do continue to either be on a long-term lease of land or have a number of agreements with us. You made reference earlier to RGI, for example. So not sure, I'm trying to understand what is the risk for us to lose affordable units in the non-for-profit sector with the end of agreements. That quote raised a flag, and I'm just trying to understand what it really means.
Thank you, Chair and Councillor. The risk really is we really don't want to lose any of this community housing stock, right? That's there. This is significant housing infrastructure. It's already very affordable. There's already governance structures in place to keep it operating. And a lot of investment has gone into it over the years, even if it's in a poor state of repair. So the risk is when they're at the end of their operating agreement, they may have an option to exit entirely and and dissolve themselves as their not-for-profit status, or just exit providing affordable housing under agreements with the city and go their own way. So we do want to provide them with incentives to do that. I can say, and on a positive note, the vast majority of housing providers do not want to exit their agreements with the city. It's in the in the years I've been working with housing services, I'm only aware of maybe one or two that have done so. The rest continue to work with us and with our community housing branch to renew agreements and extend them. The risk for them is that their funding is uncertain moving forward, because when they're providing these low rents, other than our RGI subsidies and things like that, they don't have anything to lean on. So we do have to work with them closely to make sure that they do remain financially viable. And in some cases, that does mean mergers and acquisitions by other not-for-profits. So we've had a recent one, CCOC acquired a smaller housing provider recently, for example. So these are good news stories where the sector is is leveraging its resources and coming together so they can be more efficient as well.
Okay, yeah, no, that's helpful. On the last report, the homelessness prevention program investments, my eyes moved to page 11. So you're giving a pretty good update on the 236 supportive housing beds. I wonder if you can share the figures of what, I think it's important for us as council and the public to start seeing what are the capital costs and how expensive is it or not to support supportive housing. Are you able to share those figures with us of how does the economics work of these projects?
Sorry, Councillor, which page were you referring to in the report?
I wrote page 11. I think it's your reference to 236 supportive housing beds coming in 2022.
Okay. Yes, these beds or units, however we want to describe them, are really important. And yes, they're very expensive to fund. So these are purpose-built residential buildings. I like to call them communities because that's really what they are, where people with a variety of needs and supports are offered very affordable housing. So usually at an OW or ODSP maximum shelter allowance rate, that's typically around $500 or less. We've got supports, we have on-site staff. It's a semi, independent living kind of environment, not your typical apartment building, and they work out very well. We've got a number of them now across the city with organizations like Shepherds of Good Hope, John Howard Society, Cornerstone Housing for Women, and for what we would call higher acuity individuals in the homelessness system, this is often their best chance to get out of a shelter and into housing, and they often integrate quite well into communities too. I mean, we have a lot of NIMBY when they're introduced, but the vast majority, we seldom have problems afterwards. If there are, maybe for 6 months or a year, and then things calm down and they work out very well. In terms of cost, the cost has increased substantially because of the pandemic. So the cost before might have been anywhere from $200,000 to $300,000 per unit. Now we're looking anywhere from $400 to $500, maybe even approaching $550 or $600. It's becoming very, very expensive. It also depends on where the units are being built, land cost, type of construction being used. With the most recent Rapid Housing Initiative, we were required to tell providers to use modular construction methodologies, which I think the government thought would be faster and more economical, and it didn't really turn out to be so. It's relatively new for the city of Ottawa. It's introduced new costs and challenges. Not to say it's a bad idea. I think it's building capacity, but it's been very challenging to get some of these up and running. But they are all underway, nevertheless, and they'll be very transformative for the shelter system. We'll soon be at a point with some of the shelters, one in particular, Shepherds of Good Hope and Cornerstone. They'll soon have more supportive housing beds than they have shelter beds, which I think is very significant.
Yeah, it is very important for sure. I wonder if based on that, you're able to share an IPD of these projects a little more specifically, because I do think it is a transformative period here, as you've described. Couple of follow-ups. So we're spending $15 million in supportive housing, but we make reference to $20 million in shelter. And on page 7, we're talking about $72 million investment in housing agencies. So we're starting to see the push and pull of we need to grow housing, but then we're sustaining what is an expensive set of models. So could you comment on, and I guess building on to Councillor Kavanaugh's point on the block funding, is the block funding going to be a cost saver to the City of Ottawa so that we can release funds and build new housing? Or if not, what is it intended to do, the block funding?
Okay. Thank you, Chair. I'd like to say yes, eventually block funding will be a cost saver, but we won't know for sure for at least another 2 to 3 years. We need to change the way we operate our shelters. The other piece is availability of affordable housing for individuals to move to. And I understand Council's desire to fund affordable housing more than funding emergency shelter services. But we do need that front door, especially with the lack of affordable housing and lack of options for a number of our clients. One area where I think the block funding is going to make a significant difference will be especially with shelter providers who do have the supportive housing. So we're hoping we'll see efficiencies there, things like staffing and services that are being offered. It can be shared between the shelter and the supportive buildings that they own within their portfolio or among each other. I think that would be positive. We're looking to have caseworkers in the shelter system. So already we do with all the shelters, they do have caseworkers that often provide services to individuals that are in housing. So this is all part of a larger transition, but it's like turning a big boat, right? It will take time, and it's also impacted by inflows and outflows. So the homelessness system is very regional. We are between Montreal and Toronto. We do have a lot of services to offer individuals, and we're looking at that. We're discussing these aspects with the province, and then all these market impacts on housing, economic impacts, migration, all these things impact the flow into our emergency shelter system. So we have to be cognizant of that and make sure we have a modern and resilient front door to handle these these challenges.
Okay. Coming back to supportive housing, and Saeed, I appreciate your clear answers, and I think it's helpful for a committee and the public to hear your clear answers. You and I might debate policy and funding priorities. That's all fair game. But I do not want to challenge your knowledge. You're quite knowledgeable, and you do bring a strong vision to the housing branch. My last question is relating to family supportive housing. So we do use family motels too often. You and I have had a number of discussions from families taking the benefit to families waiting for an RGI unit, to larger family challenges. And most recently, it's become apparent that some of the families in motels really aren't suited for independent living. And there's sort of this world of conversation that we're having around, I don't know if there's a name for it, but I'll call it family supportive housing. And I'd like to hear from you a bit about that in these funding streams.
Thank you, Chair. Yeah, this is very complex. I think traditionally we've thought as families as maybe needing fewer traditional supports as individuals in the shelter system, and especially in your ward, councillor, I know that you see a lot of families with very acute challenges facing them, and mental health or addictions, or people are faced with all sorts of challenges. So we are looking to see how we could provide better supports, and if we could create a better supportive or transitional emergency family shelter environment or housing environments. We are having those discussions with the sector. It's still early days. I think OCH may be able to play a role in that as well going forward. We have some existing models that we can build on. Catholic Center for Immigrants, for example, we've got a very strong model there with Welcome House in Councillor Dean's ward. And so I do think we can build on some of these. Again, it is capacity, though. It's capacity within the sector, funding. These are all key aspects. And I think we've got a lot of good community agencies to deal with, but we do need to start building that foundation with them on the family side of the homelessness problem. So I'm in agreement with you, but we are still in early days with developing something like this, supportive housing for families.
Thank you, Said, and thank you, Chair, for the flexibility. Appreciate it.
No problem, Councillor. Okay, we'll go through the three items in order. So on item number 2, the Canada Ontario Community Housing Benefits, is this carried? Carried? Thank you. Item number 3, the Canada Ontario Community Housing Initiative 2022 to 2023, is this item carried?
Carried.
Carried.
Thank you, everyone. Item number 4, Homelessness Prevention Program Investment Plan 2022 to 2023. Is this item carried?
Carried.
Carried.
Thank you, everyone. Thanks for the great discussion and questions today on these 3 items. And thank you to staff for coming out to answer them and to provide a presentation. Said, you've done a wonderful job in this role. We truly appreciate your hard work. I know we go back and forth quite a bit, and I know that you're in contact with other councillors constantly. You've done a wonderful job, and so has your team. So kudos to you and to your team. Today, we have no in-camera items, and we have no information previously distributed. Do we have any notices of motion for consideration at a subsequent meeting? Seeing none. We do have one inquiry today from Councillor Tierney. This is a great inquiry, one where I believe that we do need an update. I think that there is some good news coming this fall, but I think that this is important to ask this question nonetheless. So, Councillor Tierney, please, over to you.
Great. Thank you very much, Mr. Chair. And it was a pleasure to work with you on this. And it kind of dovetails with, and it's kind of bittersweet watching Keith announcing he's hanging it up, but this is something I know he's been very passionate about, like anybody, for the last 12 years on council. The class booking system has been a complete nightmare. And given that the city is now working on a complete replacement of the class provided poster system with the sufficient server capacity to meet the concurrent user volumes, currently cause delays on opening nights of registration, and the system on target will be running by the end of 2022. In the following scenario, when we're looking at new booking systems, if there are 20 slots open for swimming lessons at a particular facility, is it possible that a percentage, example 25, be reserved for in-person bookings only at the facility? And Mr. Chair, just to give context to it, this is one of the complaints that we get typically as councillors, is people open up 4 computers and they'll book as quick as they can, and they'll take whatever location they can get themselves into, disadvantaging people that don't have transportation, that might live next to a facility like a splash wave pool that really doesn't give that opportunity. So if there's a way we could look at that, and I've spoken to Mr. Chenier, he seems very interested as well. I think that would go a long way for the disadvantaged that don't have transportation or access to that kind of programming. So anyway, that's my inquiry, and thank you very much, Mr. Chair.
No, that's an excellent point. And this is a legacy issue that we've been dealing with for quite some time, because I can remember, doing recertifications and doing different courses. I think I took my national lifeguard standards in Sawmill Creek, despite the fact that I lived here in Orleans. So that is a problem that's existed for a while, and I appreciate you raising it, and all the work that I think every single one of us on this committee and our extended council colleagues have raised concerns about in the past. So looking forward to that response and to the upgraded system later on this year. Sawmill Creek, by the way, is a great pool.
Thank you.
It's wonderful. On adjournment, is this motion carried?
Carried.
We are adjourned. Thank you so much, everyone, for the great discussion today. The next meeting of the Community and Protective Services Committee is scheduled now for Thursday, May 19th, 2022. Looking forward to seeing you then. I know we'll see you before then, but thanks again for the great discussion today, everyone. Have a wonderful day.
Good job, Chair.
Bye-bye. Thanks.